You, our employees, define who we are as an organization and are critically important to our success. We value and need your input and involvement. We also realize that we must continually improve. Fortunately, you understand this and care about creating a better experience for our patients. We want to recognize those who have gone above and beyond to make specific improvements and have helped benefit our patients and our organization. This is our thanks to you.
It was really obvious when you go from room to room that things weren't in the same place and it was hard. The staff and the providers knew that it was an issue and have wanted to have standardization, but it's a fairly big deal to clean out all the rooms and start over, and we were a little bit concerned about how we could get that done. I felt like I needed to take action personally because the scope of this project is pretty big, and we wanted to change the way 8 different providers set up their exam rooms, and that all of the staff would be on the same page, so it was going to impact 25 people. And moving people's stuff is a big deal.
Well, our improvement happened in 2 different areas. One was our phlebotomy workstation. Our phlebotomy staff were having difficulty drawing patients in a reclining chair, and they didn't have the tools they needed to make the process faster. The second change happened in our lab, where we had the staff to do the testing, but not enough workstations in order to do the resulting of tests. I felt I had some personal responsibility for the well-being of our department. Our patients are having less wait time because we can now utilize all 4 draw rooms, and our providers are getting back their results in a much timelier manner. We have lower or shorter turnaround times for our lab results.
We've had some concerns over policies and procedures and making sure staff are using the most current version of documents. And we struggled, being at such a large group, to make sure that we were putting forth changes that were consistent and universal. We were approached by the Performance Improvement Department about a new software that was available to us, and it's called Universal Content Manager. And it served the purpose of everything that we needed to house and maintain our documents. And so once I heard this, I really just pushed forward and pulled a project together and formulated the processes and procedures around this documentation and successfully implemented the use of the program through our whole department.
There's a lot of support for us to do lean and standardization. I think the organization supports us through lots of training opportunities, and that's something that we can all use throughout the system. On our campus, our administrator and our providers certainly understand the importance of having efficient exam rooms and efficient processes, and so we had a lot of just general support about the idea of it all.
We were supported in a variety of different ways, anywhere from our administrator or director. They've always empowered us as staff members to go above and beyond and to take whatever necessary actions that we need to do to make changes and make improvements.
I actually have a very wonderful boss who has a vision that she tries to pass on to all of our department. And part of that vision is making sure all staff have the right tools and are working efficiently.
I learned from participating in this improvement that it takes a lot of planning and coordination. And things beyond the everyday stuff that you would think about. So you plan the training, you identify it, and you do the steps of the 5S, which are very clearly laid out and very easy to follow. But the in-between stuff as a leader, being able to celebrate people's successes.
If we work together, we can make improvements, and it can have a positive impact both on each staff and our patients and our providers.
If you have an idea, take it and run with it. Somebody will agree with you that it is an improvement.